Hip replacements these days are really good. The components are expected to last about 25 to 30 years, and they move like a real hip so much better than they used to. So people go back to doing a much higher level of active and athletic lifestyle after recovery. But to allow this to heal properly so you can get back to doing what you love, give yourself permission to take things slowly at first. We don't recommend an aggressive regimen of exercises the first 6 weeks. The total hip replacement takes about 9 months to completely heal. The first 2 weeks are typically the most painful because your body's ramping up and down through the inflammatory phase as it responds to the trauma of the surgery. So you have more pain, more swelling. That usually peaks around day 7. So for that reason, we have a very basic regimen of exercises for you the first 2 weeks. Even if the exercises feel too easy, that's exactly what we need for you to do. It keeps you in a therapeutic range of activity, not too much, not too little. During the first 6 weeks, your body needs time to build a good foundation of healing. The bone needs a good 6 weeks to bond to the textured surface of the implants. The metal components, especially the shaft implanted in the femur, has a textured surface. As the bone heals, it grows into the texture of the implant, making a strong fusion. The soft tissue also needs a full 6 weeks of healing so it can tolerate a lot more force and stabilize the joint. Exercises during the first 6 weeks can seem very boring, and you can feel like you're not doing enough. You might feel like doing so much more than what your hip is actually able to tolerate. Your pain might be very low, but the bone and soft tissue have not healed up enough to tolerate the forces of normal activity. Just remember, you're allowing your hip to heal properly so the bone can fuse with the implants and the soft tissue can stabilize the joint. Your pain might be higher than expected. It's not usually a sign of a complication, but keep up with your scheduled follow up visits with your surgeon. If you feel there might be something wrong, contact your surgeon's office. Complications are rare, but they do happen sometimes. It's better to have it evaluated sooner than later. Just remember, there's a wide range of normal the first several weeks after surgery when it comes to pain, strength, activity tolerance, and so forth. Everyone heals at their own pace. After 6 weeks, even though you still have more healing time to take place, you can usually start to increase your activity in much larger increments. This is the point where you might be able to get back to the driving range or the golf course, take some swings with the tennis racket, get back into the pool, or go to the gym. Your new exercises after 6 weeks will also ramp up to a more appropriately challenging level. Remember, this process is a marathon, not a sprint, so give your body a chance to heal. That's going to set you up for success in the long run and avoid any self inflicted complications from overdoing it.